Well, welcome everybody. We're glad to have you all here today for this webinar scheduled for today, hosted by the Physical Activity Alliance. We appreciate you jumping on the call today to be able to talk about this very important issue. For our webinar today, we're going to be talking about engaging the community to create a healthy and safe youth sport environment, putting the U.S. National Physical Activity Plan sports sector into action. As an organization, the Physical Activity Alliance is relatively new. We've been around for about 2 years now, and we're collective organizations that are dedicated to promoting physical activity. We support initiatives like the Active People Healthy Nation from CDC, which has a goal of trying to get 27 more people physically active. We support policies like active transportation, the Promoting Physical Activity for Americans Act, the Personal Health Investment Today Act, and many other provisions and legislation and regulations that are out there that help promote physical activity. As part of our organization, we're split into 3 different sectors. One is the policy sector, the other is the professional development sector, and the last one is the National Physical Activity Plan, which is where we're going to be discussing one of the parts of that National Physical Activity Plan. I will tell you, if you're interested in joining the organization, we'll make sure we communicate with you, and feel free to reach out to us. The more we have that are out there to help us support, physical activity policies and objectives, I think the more powerful we can be as we act as one voice. You will see that we have a number of you can see our founding organization, our board that we have right now, the list of them right there. And we're very proud of these organizations and the way that they have come together to be able to help promote physical activity policies. As we go through this presentation, if you have any questions that you'd like to ask, there's a Q&A button at the bottom. Feel free to put a question in there, and we'll make sure we try to answer it as we get towards the end of the webinar. So today we have some great panelists to be able to help us discuss these different issues as we talk about the National Physical Activity Plan. And first we have Karen Pfeiffer. She is a professor and interim chairperson of the Department of Kinesiology at Michigan State University. She's also a member of the Center for Physical Activity and Health. She's an exercise physiologist with an interest in population-based investigations. Her research focuses on 2 major areas, both of which are related to physical activity in children and adolescents. She is the National Physical Activity Plan Sports Sector Chair, a board member for ACSM, and also on the leadership board for the National Youth Sports Health and Safety Institute. Our other panelist, Tom Ferry, is the executive director of the Aspen Institute Sports and Society program, and he's been involved for almost over 4 decades in trying to work towards building, connecting organizations together for media and sports and building a healthier America. He's done that through using essential knowledge, pioneering ideas, original tools, shared strategies, and a cross-sector movement to grow the quality and quantity of recreational opportunities in communities everywhere. I thought it was very interesting. The New York Times described Tom as a leader dedicated to improving the world through sports. In 2011, he founded the Sports and Science program at the Aspen Institute to convene leaders, facilitate dialogue, and inspire solutions that can help sports serve the public interest. And 2 years later, he launched the Project Play, which he'll discuss maybe a little bit later during his presentation. It's a signature initiative which helps build healthy communities, and which one of ACSM, we're very proud to be part of that. Finally, we have Thane Muntz, who is an assistant scientist and director of the Athletic Health and Performance Lab in the Environmental Influences on Health and Disease Group at Sanford Research in Sioux Falls, South Dakota. He is also an associate professor in the Department of Pediatrics at the University of South Dakota Sanford School of Medicine, and has a graduate facility appointment or faculty appointment in the Division of Kinesiology and Sport Management at the University of South Dakota. He's a fellow of ACSM and serves on several sports medicine leadership boards, including the National Youth Sports Health and Safety Institute. His research encompasses several areas of athletic health and performance with the goal of generating evidence-based knowledge that can inform practical applications on the playing field and in the clinic. Welcome to our group today, our presenters, and we'll start with Karen kicking us off. Karen, the floor is yours.
Thank you, Monty. Hello, everyone. Welcome, and thank you for joining us today. I am kicking us off by briefly giving you an overview of the U.S. National Physical Activity Plan. Next slide, please. If you go to the website that you see I have listed at the bottom of this particular slide, you will see that I have taken verbatim the vision of the plan, which is that one day all Americans will be physically active and they will live, work, and play in environments that encourage and support regular physical activity. And so, as Monty noted, the Physical Activity Alliance houses the National Physical Activity Plan. And really what the plan is a set of policies, programs, and initiatives designed to increase physical activity in the US population. And really, this plan was rolled out shortly after our first ever US national guidelines for physical activity were implemented in 2008. And this is really a roadmap for how we can achieve the National Physical Activity Guidelines. Next slide, please. The first version of the plan was released in 2010, so just a couple years after the physical activity recommendations were published. And then there was a second plan released in 2016. Over time, the plan has changed, and there are planned regular updates to the plan over time so that we can create edits that make sense as we grow and as we achieve more and more physical activity milestones. Currently, we have 9 sectors reflected in the physical activity plan. Those are business and industry, community recreation, fitness and parks, education, faith-based settings, healthcare, mass media, public health, transportation, land use, and community design. And then the final sector is the sport sector, which we will be talking to you about today. Now, there is also a plan to add another sector as we're going forward as well, related to the military. And the sports sector is our major interest, as I indicated. The entire plan is based on the socio-ecological framework. And that's important because the social ecological framework recognizes that there are individuals, and individuals interact with their own settings and each other. And there are various levels at which they can interact, to interact more in an interpersonal fashion, to the community level, to the policy level. And the plan is meant to reflect all of those levels and is designed to be inclusive for all sorts of populations. Now, each sector of the plan has created strategies, tactics, and objectives. And those strategies, tactics, and objectives exist as essentially a roadmap to help us increase physical activity in the US population across those various sectors. So each sector has its own very specific strategies, tactics, and objectives. Next slide, please. What we will address today is a very specific strategy from the sports sector, and that is strategy 5, which is that sports organizations should ensure that sports programs are conducted in a manner that minimizes risk of sports-related injuries and illnesses. There are 4 tactics that are part of this strategy, and then there are a few objectives associated with a couple of the tactics. And we did not put the objectives up on this particular slide for the sake of brevity, but you can find all of the strategies, tactics, and objectives for all of the sectors on the National Plan website that was earlier in my slides. The first tactic that is part of strategy 5 is to establish policies and practices that ensure sports programs put the highest priority on the health and safety of participants. The second tactic is to educate parents, athletes, coaches, teachers, and others about signs and symptoms of sports injuries and conditions. The third tactic is to ensure that sports equipment, uniforms, playing surfaces, and environmental conditions are checked for safety and best conditions. And then the fourth tactic is to encourage importance of collaboration with medical professionals to ensure safe outcomes during play. This strategy and these 4 tactics are important for what you'll learn about later on in this webinar today, because this provides an example of how you can achieve Strategy 5 and its tactics. And as we progress through the webinar and you hear from our colleagues, you will see a video that very much highlights how a community can come together and achieve one of the strategies of the sports sector of the national plan. And you will also see some resources to be shared so that others can adapt to their own unique circumstances and enact the physical activity plan in where they live, work, and play. Thank you.
Thank you, Karen. Appreciate that. Thank you for your remarks. We'll now move to Tom Ferry from the Aspen Institute and Project Play. The floor is now yours.
Okay, well, thank you, Monty, and thank you, Karen, as always, for the nice setup. All right, so I'm going to talk to you about the Children's Bill of Rights in Sports, which is really built on top of and aligns with the physical activity plan. I was part of the group that was originally helping draw up the sports sector recommendations, and it's great to see all the momentum that has been built up behind it. But this is a long-term process. It's about resetting the landscape, the culture and structure of youth sports in a manner that that takes words and makes them enforceable. So one big thing, one contribution that we've really tried to make to that is developing the Bill of Rights in Sports, which was drafted with a set of human rights experts aligned to the United Nations Convention on the Rights of the Child. And we tried to just, do three things. One was to highlight the value of using human rights frame to grow access to sport. Number two, inspire organizations to adopt minimum standards for youth participation, including in the areas of health and safety and injury prevention. And then ultimately downstream to really unlock the full power of sports to address a range of societal needs. Next slide, please. So, we try to get the language right, working with this drafting committee, and then we try to build momentum behind it. And the good news is we didn't know if we were going to get 5 organizations to sign up originally, but we had 60 when we went out the door with this in August, and it's now above 80, plus more than 300 athletes, including Alex Morgan and other Olympians. You can see some of the groups that have basically said this is a North Star. U.S. Olympic and Paralympic Committee, the YMCA, ESPN, NRPA, which is a key player, Little League, the largest youth sport organization in the space, and about a dozen NGBs, including U.S. Soccer, USA Hockey, USA Gymnastics, USA Baseball. HSS is in there. HSS is a really important partner of ours. We're really thrilled to have them involved. They are fully dialed into the notion that if we're going to improve the culture and structure of sports in this country, reduce attrition, that we really need to think about injury prevention strategies. So we work very closely with HSS along with CDC and ACSM. They're the 3 players in our core group that we work with significantly. Next slide. So, when we package this thing up, we say, okay, what are the 8 rights that children have in the provision of youth sport experiences? And so, again, all of this ties to language that is in the Bill of Rights in the United Nations Convention on the Rights of the Child, which other countries, including Norway and Japan, have all used to develop their own form of a children's Bill of Rights in sports. So the first one that we put in place was really, that all children have the right to play sports, that they have the right to have organizations make every effort to accommodate their interest to participate and to play with peers from diverse backgrounds, that providers should develop policies and practices and partnerships to include youth from underrepresented populations and create programs that both meet and stimulate youth interest in sports, we know, we collect the data on this, on an annual basis. We know that most kids do not have a sustained sport experience into high school. And then as they move through high school, as you'll see in another report that we will release on Tuesday, they really begin to develop interest around fitness activities, more unstructured play opportunities. And so, schools, other providers really need to recognize what kids want there. The second call to action is really around to safe and healthy environments. The children have the right to play in settings free from all forms of abuse, physical, emotional, sexual, hazing, violence, and neglect. And we define all these terms on our website. Must be provided safe and inclusive playing facilities and equipment. And we recognize that the physical nature of sports means that all risks cannot be eliminated, but the program should take precautions to protect youth from harm and dangerous situations. Third is to qualified program leaders. The children have the right to play under the care of coaches and other adults who pass background checks, and that coaches should also receive training in, at a minimum, general concepts in coaching youth, sports-specific coaching, the emotional needs of children, injury prevention, CPR and first aid, and abuse prevention. The next right that we recognize that children have, that they're born with, is to developmentally appropriate play. The children have the right to play at a level commensurate with their physical, mental, and emotional maturity and their emerging athletic abilities. That means roster sizes, rules, equipment, very similar to the language you just saw Karen present. Should not be subject to inappropriate pressure or exploitation. And the reasonable effort should be made to recruit and accommodate youth with disabilities. How can you mainstream them where appropriate into the activities that you're providing to the community in general? The next one is to share in the planning and delivery of their activities. So this is really about voice and choice, right? It's about giving kids an opportunity. Here, I'm going to put this language in the chat. It's really about giving kids the opportunity to just have a say in the experiences that they want. What we know from youth sports is that it's designed by adults for adults, well-meaning adults. But how do you incorporate the voice of kids at the outset and through exit interviews and through maybe aggregating their opinion through youth surveys and so forth? There's a lot of room that could be done in sharing in the planning and delivery of their activities. The sixth one is for an equal opportunity for personal growth. The children have the right to have programs invest equally in them, free of discrimination based on any personal or family characteristics. Policies on minimum playing time in games should be established in recognition of the evolving capacities of youth, with a bias, especially at the younger ages, toward roughly equal playing time over the course of a season. They should try and create balanced teams where possible and be judicious in creating competition formats that favor early bloomers to the exclusion of others, because we know that can lead to early attrition. Kids feeling like they're just not good enough. The seventh right that children have that we recognize, that we ask everyone to recognize, is that children have the right to be treated with dignity. The children have the right to participate in environments that promote the values of sportsmanship, of respect for opponents, officials, and the game. They have the right to make mistakes and fail without fear. Policy should be established and enforced to prevent bullying behavior by coaches, parents, spectators, and teammates. And the eighth right is, arguably what should be the first right. In fact, in Norway, they make it front and center, which is simply to enjoy themselves. This is about fun. The children have the right to participate in activities they consider fun and which foster the development of friendships, the prime motivation that we know from our surveys that many kids choose to participate. Coaches and administrators should create the conditions to help them find comfort and happiness, and which in turn can facilitate love of sport, self-learning, mastery, and sustained engagement in sports. We believe that with the rights of youth as a foundation, we can build a better house for all of sports. Next slide, please. Sorry, I spent a lot of time on that one slide. So, you want to learn more? Look, we we just opened registration for the Project Place Summit 2022. It's going to be in DC at the Andrew Mellon Auditorium. We're going to have several panels on this. We're going to push forward this conversation. We're going to identify opportunities for people to, to learn how to embed the Bill of Rights, make it part of what they do on a regular basis. So I think back to you, Monty.
Thank you, Tom. I appreciate that. And thank you for walking us through that Children Bill of Rights. I think it fits very well, as you said, with the thing that Karen was talking with the National Physical Activity Plan, and it's a great document at ACSM Sports as well. Now we'll turn this time over to Tom, or I'm sorry, Tom, back to Thane. Let me go to Thane. How about that? Thane, the floor is now yours.
Thank you, Monty. It's my pleasure to be here as part of this webinar with Tom and Karen. As Monty described in our introduction, both Karen and I serve on the leadership board of the National Youth Sport Health and Safety Institute. That is a partnership between the American College of Sports Medicine and my employer, Sanford Health. A couple of years ago, the leadership board wanted to take a leadership role in the sports sector of the National Physical Activity Plan. We wanted to put that plan into action and see how we could take the great material that's there and really get it out in front of youth sport organizations so that they could start implementing those strategies and tactics. But we wanted to show them how to do that. Next slide, please. So as Karen indicated earlier, the sports sector is really the focus of this webinar. And among the 8 strategies that are outlined in the sports sector, there was one strategy, Strategy 5, that really resonated with our leadership board. And Karen talked about that earlier, and it's the one that deals with minimizing the risk of sport-related injury and illness. The National Youth Sport Health and Safety Institute, our primary mission is to promote the experience, the development, and the health and safety of our youth who participate in sports. So this was a perfect alignment for what we thought we could have the biggest impact in, and where we had the most expertise, and what we could really lift up through this strategy to other sport organizations. Next slide, please. Our thoughts were to highlight a youth sport organization that was already doing the things, the tactics that are outlined in Sports Sector Strategy 5. We thought by showing an example of a youth sport organization that are using those tactics would be more powerful than simply describing those tactics through words. And in that way, again, to illustrate how the strategy and those tactics are being put into action. Next slide, please. It didn't take me long to read through those tactics and recognize that a youth sport organization that I work with very closely, South Dakota Junior Football, was checking the boxes for those tactics that are outlined in the sports sector. South Dakota Junior Football. This is a community-based football program based in Sioux Falls, South Dakota. It is led by volunteers, so the coaches and the parents the coaches and the leadership board are all volunteers. Most of them are parents. It's a long-standing program that's been around since 1969, so it's got a lot of sustainability, and it's a strong program, and it has grown to approximately 2,700 youth players that represent both tackle and flag football players. So the National Youth Sport Health and Safety Institute, we created a video that highlights the great work South Dakota Junior Football has done over the years that align very well with the tactics outlined in Sports Sector Strategy 5. And we developed this video not only to recognize and celebrate the good work of this organization, but also to encourage and inspire other youth sport organizations around the country to follow the lead of South Dakota Junior Football and use their own circumstances and their own environment to their advantage and to their benefit to create that environment that does minimize the risk of sport-related injuries and illness. So we're going to play that video for you now. I hope you enjoy it. Thank you. As a leadership board of the National Youth Sports Health and Safety Institute, it's important that we take a leadership role in the National Physical Activity Plan sports sector. South Dakota Junior Football, in partnership with Sanford Health,
provides a blueprint for putting the tactics of Strategy 5 into action.
Inactivity is a national health problem, and we're hoping that we can use youth sports to try to intervene in that public health problem. We're here at the Sanford Sports Complex, where you can see in the background the football fields and games and the kids being active today. We're hoping to look at ways that we can make youth sports fun for everyone and get more people involved. We're trying to use the latest research techniques and public health interventions to try and keep kids active as much as possible. It's clear that kids who are active become active adults. And it's also clear that a lot of kids drop out of youth sports, often way too early. So we're hoping that if we can make this fun for them, they'll stay with it longer. We're trying to develop a system or a program that can be adopted nationally by any group. And we're hoping that the structure that we're developing through Sanford will help you make your program the best and the most competitive and safest for kids in your area.
South Dakota Junior Football is a youth instructional football program established in 1969. We're currently in our 52nd year of operating. We have about 2,000 kids annually that participate in the program. About 7 years ago, we started a flag program, which has about 700 kids in that program, which is pretty good for a relatively new program. Mainly, we focus on developing our youth in preparation for their high school years. Our focus is on working with the fundamentals of the game, obviously, but trying to keep the kids in a safe environment and also creating a positive attitude for the players that all participate.
The game of football has evolved over the last 20 and 30 years, and South Dakota Junior Football has evolved along the way. They've really put the health and safety of their players first and foremost. They've done that through coaching education and certification, through making sure that they've got proper equipment and that their fields are well maintained, that parents and athletes and coaches are educated on the rules of the game and how to properly play the game to minimize the risk of injury.
USA Football works with thousands of youth football leagues across the country. When we have the opportunity to recognize and applaud the efforts of a league like South Dakota Junior Football, who is setting policies and procedures that have the interest of the athletes at heart, we know that this is a league that is setting a standard that we want to have other leagues follow. By putting procedures in place that really have the best interests of the kids at heart, we know that leagues like South Dakota Junior Football are really setting a gold standard for leagues across the country. SDJF is setting a gold standard within the youth landscape, the youth football landscape, and that's very important to organizations like USA Football so that we have leagues that we can point to that are making these extra strides and going the extra mile in setting policies and procedures that are really not only going to focus on what's best for the athlete as a football player, but what is best for the athlete as a person. And by paying attention to these safety policies and by creating these types of environments that are safe not only physically but emotionally, we know that we're hitting the mark and we're setting a gold standard. So to recognize leagues like SDJF that are doing it this way really gives us a beacon that we can point to for other leagues to look at and learn from.
South Dakota Junior Football's relationship with Sanford Health started back probably about 25 years ago with implementing basically a bag program where Sanford would provide medical bags for all of our teams in our program. You know, the bags would consist of your basics, Band-Aids and tape and ace wraps and a couple ice bags. And so we've been doing that for a long, long time. Over the years, it's obviously changed and enhanced our program to the standpoint where we have certified athletic trainers at all of our games that are provided by Sanford Health. And then also some programs that we've done with Sanford Research regarding concussion studies, baseline testing for all of our players, especially our older players, the 3rd and 4th, 5th and 6th graders, 7th and 8th graders. Over the years, the game of football has changed a lot, in particular with the media presence and the focus on injuries in the college and in particular the NFL. So, you know, a lot of parents are kind of hesitant. We believe there's kind of an attack on the game of football. Should the kids play? Shouldn't they play? So a lot of people have opinions on that, but there's no facts to back it up. So we've been proactive with our relationship, not only with Sanford, but also with USA Football. South Dakota Junior Football was a pilot program with USA Football in helping them develop their currently their Heads Up program. We were one of 5 programs in the country that worked with USA Football to develop the Heads Up program that we all use today. We strive to make sure that our parents are aware that, for example, all of our coaches are Heads Up certified through USA Football. All of our coaches have to go through a background screening so that the parents know that their child is being put in a safe environment, both from the teachings that we do of the game of football, but also from the quality of the people that they're working with, in particular their coaches. Again, it's about the safety of the players, whether it be practicing or in games or just the people that they're around relating to South Dakota junior football.
Injury and illness can really hamper a child's experience within the game of football, or any sport for that matter. But when we want to have great participation rates, we want to have great retention rates and keep kids involved in our sport, part of that is keeping them out there on the field. Children sign up to play sports. They don't sign up to stand on the sideline. They don't sign up to be injured or not be out there with their friends. So making sure we have protocols in place to keep kids active and healthy, or on the back end, we have the right partnerships to make sure that we can provide athletic training services to get the kids back out in the field, keeps them involved in the game. Being involved in the game and with their friends is what leads to great experience. This contributes to players coming back to our great game, or at very least, having a positive outlook on physical activity and developing healthy lifestyles. Youth football can be seen as unique because of the protective equipment worn in our game. This gives leagues a unique challenge that some other sports might not face. With the standards in place by our partners as far as equipment fitting, equipment recertification, and standard of care for playable equipment, it is key for youth organizations to be really clued in to changing standards, what's new on the market, and what they need to do to make sure their equipment is up to date and in line to be certified available for play. When organizations take on these programs and they look at how we're going to refurbish and refit our equipment, how we're going to make sure it's reconditioned, making sure we're following equipment manufacturers' guidelines on rotating out helmets once they've meet their age restrictions, this is key because not only does it keep our players healthier and safer, but it also shows our parents that we are committed and everything we are doing is to make sure we provide the best experience for your youngster.
So South Dakota Junior Football's partnership with Sanford Health is a perfect example and model of a community partnership. We couldn't perform the research that we do on health and safety in youth football without a partner like South Dakota Junior Football. And to the same token, they couldn't provide the level of health and safety to their athletes without a medical partner like Sanford Health. So it's mutually beneficial. And when I like to tell people that these football fields are my laboratory, and they're literally right out the steps of my office. But we come out here, we work with the athletes, we work with the players, we collect novel data, we interpret it, we share the results, and we make the game better. What we've really seen is that I think it's a better experience overall for the players. I think parents are more comfortable signing their kids up to participate in this organization because they know the leaders, they know the board and the coaches have the health and safety of their players in mind. And it's not just talk, it's actions. It's things steps that they've taken from the moment they sign up and from the education that the coaches are receiving when they go to equipment handout and they see that there's 20 board members there fitting them with equipment and they see that it's reconditioned, recertified equipment and they're getting good stuff for all of the teams. And there's athletic trainers on the fields and they know that if their athlete gets injured, they know who to call, they know where to go, they know that the league is taking care of them. They see researchers out in the field that are monitoring players and collecting data and doing things that aren't being done anywhere else in the U.S. And that's through a partnership with South Dakota Junior Football to really improve the game and make it healthier and safer for all players.
I would hope that most of the health organizations in our country would have a similar approach toward working with the youth organization as what Sanford has here in Sioux Falls, South Dakota, and the surrounding area. Having that relationship has just been great. It adds credibility to our program. It adds security to our program from a parent standpoint when we go out and talk to parents, especially in communities surrounding Sioux Falls, South Dakota, that are interested in joining our program and having their kids participate. They want to know, what are you doing to keep my son or my daughter safe? And when we talk about all the things that we do through education, through USA Football, the certified athletic trainers through Sanford, the concussion study that we're doing with Sanford, baseline testing with Sanford, all the things that we do, it all adds to the credibility of the program and the safety that the parents see and the comfort level that they would have in allowing their kids to participate, not just in South Dakota junior football, but in the game of football, period.
I would say at these young ages, especially second grade football, I feel like it's the safest time to ever play the game. I mean, the speed and the physicality is just not there. They're learning the basics of it, having fun with the game. And I think, through the early ages, it's a safe time to play the game.
The remarkable thing about this organization is that it's led by volunteers. The coaches, the leadership board are all volunteers. So they don't have to take any of these steps. They could simply put rosters together and go out and play games. But they take the extra effort to make sure that they're putting the health and safety of their players first. And it really does take a coordinated effort on their part to be able to bring in these different steps and put them into action over the years. It didn't happen overnight. They've added the education pieces, they've added the fields, they've added the equipment procedures. Those have all been added over the years. They've put athletic trainers on site so that they could monitor injuries as they occur. That's something that never happened when I was playing. It wasn't even thought of. It wasn't even a part of the thinking process of how you would put together a youth program. So now things that are commonplace in this league are things that, again, 20 to 30 years ago, people weren't even thinking about. They didn't even realize they were important. And the same can be said for the concussion education and awareness and the research that they're partnering with Sanford Health to conduct so that we can learn more about health and safety in this game and make it better for future generations. Our institute would like to help your youth sports organization become as healthy and safe as possible and set yourself apart from the competition by following the guidelines outlined in the strategic plan of the sports sector of the National Physical Activity Plan. Youth sports is a great vehicle for physical activity and health, but you want to do it in a healthy and safe manner. And for a youth sport organization to really raise the level and provide all the things that are necessary to ensure that health and safety, it takes extra effort, it takes extra work. But at the end of the day, your program is going to be more sustainable and you're going to set yourself apart from the competition. Parents and athletes are going to want to come and be part of your organization because they know that you put the health and safety of your players first and foremost. So it is worth the effort. And when you put forth that effort, you're going to find that those actions you take are going to lead to a healthier and safer environment for your players.
We recognize that this program is not representative of all communities and circumstances. This program is unique in its location, players, coaches, and community partners. Although it may not incorporate another program's individual circumstances, this program serves as one example of how a sports organization can come together over time to create a healthy, supportive youth sports experience that will hopefully inspire their physical activity for a lifetime. The Sioux Falls football program also shows a way to fulfill the 4 tactics of Strategy 5 within the U.S. National Physical Activity Plan sports sector. Our hope is to inspire other youth sports organizations from diverse backgrounds and communities to create programs that work for their environment. Thank you.
Okay, thank you. If we could have all our panelists come back up on camera there. There we go. So we'll appreciate that video. I think as you watch through that, you can see the enormous effect that a healthy and safe program can have on its athletes and the people in the community. Thane, we'll start with you as a question since you were the star of that video. Let's start with you as a question about as you're developing community partnerships that that helps sustain a successful youth sports program like that in South Dakota. It takes time, but how did that program come to be, and how did it evolve over the years?
Thank you, Monty, for that question. I appreciate that because that's important to see when you see that video and you see the list of great things that South Dakota junior football is doing today. It can be a little overwhelming, I would imagine, for some youth sport organizations to say, how do we get there? If they're not there right now, how do we get to do all those things? How do we develop those community partnerships? How do we get the facilities, the equipment, and all those things that go into it? And South Dakota junior football really starts from humble beginnings. I played in that organization when I was in 5th, 6th, 7th, and 8th grade, and we played in a small public park that had 2 football fields, and I think only one of them had lights. And we had a small shack that stored the equipment for the league. And Shaq is generous in terms of talking about what that facility looked like. And they moved from a 2-field facility to a 3-field facility, and now they sit on a beautiful sports complex with 9 football fields. But again, that didn't happen overnight. That happened over decades. In particular, South Dakota Junior Football's relationship with Sanford Health began about 25 years ago as Larry Leverance, the former board member and coach, longstanding coach, and in fact, my former coach in that league, discussed, started with a bag program. So reaching out to our athletic trainers, they put together training bags for the coaches so that the coaches who are spread out over town and even in rural communities. So this is a youth sport organization that's not only in the urban area of Sioux Falls, South Dakota, but also in the rural communities that surround Sioux Falls. And they're far away from, in some cases, medical providers, giving them bags with first aid equipment, bandages, gauze, tape, ice packs, and so forth, so they could attend to some initial injuries. That relationship developed and worked into some wellness nights. And I had the opportunity to participate in some of those when I joined Sanford Health. So wellness education nights, both for coaches and parents, giving them information about concussion, heat illness, proper training, nutrition. And again, that's something that we worked with South Dakota Junior Football on providing to everyone within their staff. Now, what's that led to is we got athletic trainers that cover all the games for South Dakota Junior Football in Sioux Falls, which is fairly uncommon, in the youth landscape. And it's really a game changer when you can get athletic trainers on those fields to immediately attend to any injuries that could occur. It really allows for a higher standard of care than what you would typically see in youth sports. Now, moreover, those athletic trainers are available to the entire league. So if there's a practice going on somewhere in town and a kid goes down with an ankle injury, they can come over to the sports complex where those games are being played and see that athletic trainer free of charge and get an initial evaluation. Again, as part of the partnership with South Dakota Junior Football and Sanford Health. And then, the last thing, which, you really see visually is that sports complex. And this is just a phenomenal example of what we've been able to do here in Sioux Falls, where you've got a youth sport organization, South Dakota Junior Football, partnering with not-for-profit healthcare organization, Sanford Health, but a corporate entity, and our municipal government, so the city of Sioux Falls. Sanford Health donated land on which South Dakota Junior Football fields are built. The city of Sioux Falls invested millions of dollars in developing those fields, doing all the development work on the grounds. South Dakota Junior Football raised money for the goalposts, the scoreboards, the concession stands. So all 3 of those stakeholders had a lot invested in this beautiful complex. And it couldn't have been done with, alone. The city of Sioux Falls couldn't have done it by themselves. Sanford Health couldn't have done it alone. South Dakota Junior Football couldn't have done it alone. It's that partnership again with a corporate entity, sport organization, and the municipal government all working together. Again, it didn't happen over time. It happened over many years. So, just in closing on this topic, I would just like to encourage other youth sport organizations to start where you're at. See what you have available to you in your community. Start to develop relationships. That's what's most important. You don't have to get to the end line overnight. As we talk about in sports, think about process as opposed to the goal, and work through that process, and eventually you will reach those goals that you're after.
Thank you. Appreciate that. Tom, Thane mentioned, all these different organizations that kind of came together to help kind of build this amazing complex and the different safety platforms they have there. You're a great communicator, and you're one who's kind of good at bringing coalitions together. How do we get people to kind of work together in other cities to be able to get things like this until they can really promote health and safety for our youth athletes?
Yeah, I think it starts with reframing why we want our children to play sports, right? Youth sports is defined by like a performance ethos right now. People think, I want my kid to whatever, get a college scholarship or go on to play, and they see it as like a pipeline performance kind of thing. But if you really have a conversation with parents, what most of them want is for their child to be able to develop as human beings. through sports. They want a health, something that can promote physical activity, mental health, social and emotional health, for them to be connected to other kids. And so I think it starts with that kind of conversation, like, okay, let's ask why we're here. And if you create that kind of conversation, you can get people around the table, define their shared values, and then define the type of experience that underpins those values and delivers on those values. I think that's key. I mean, that's how we built Project Play, is like, okay, what's the purpose of youth sports here exactly? And you do that, and people really want sport to be a tool of personal growth and social uplift, but you have to reset that conversation. And, we've tried to do it at a national level and in the 10 communities where we've gone. And I think that's the methodology. Methodology is probably not the right word, but that's the way you do it in really any community, because parents really, they love their kids. They want the best for them. And if you can create the conversation, then you can also open this conversation around health and safety too, because no one wants their kid to be have too many concussions and they can't play in high school because it's just out of the question, or the blown ACLs or whatever else it may be. So, okay, great. How do we put prevention opportunities in place that are going to just allow kids to have a sustained experience and benefit from sports in the way that we know they can be delivered.
Right. Thank you. So Karen, kind of building off that just a little bit, a lot of your work and your research has been in youth and adolescents and sports. And why is it so important to have a healthy and safe sport experience for our youth?
Monty, I feel like I could go all day talking about why that's so important. I think that I will focus on a couple of main things. One, we have clear evidence that shows that sport participation in younger years actually does translate into being more physically active in adulthood, and translates into some other sorts of psychosocial characteristics being better down the road. And even in some ways, it's just kind of like a translation of skills that you learn while participating. And there are all kinds of different skills. It's not just being physically active. It's about learning how your body works and how to move. It's about the fact that when you get that physical activity, there are a bunch of other important things that happen, improvements in all sorts of risk factors for disease, cognition, attention, so many of these things. And so the link is just natural. And so I would just say that fortunately we have a lot of evidence that shows this is good. Getting youth involved is good in lots and lots of ways. So it just seems like kind of a no-brainer to try and do what we can to encourage programs like this one.
Fantastic. Thank you. Hey, Tom, you mentioned it during your presentation that you have about 80 plus organizations that have endorsed the Bill of Rights. ACSM is one of those, and we're a proud endorser of that Bill of Rights. How do other organizations get involved in that?
Yeah, so I just thanks for asking, Monty. I just pumped a link into the chat, and you can see the organizations that have endorsed. And at the bottom, there's instructions on how your organization can be added to the list. It really is very simple. I mean, this is a North Star. It is not being prescriptive. It is just trying to create a cultural expectation that all children have the opportunity to develop through sports. And these are the conditions people should be mindful of. So yeah, take a look at that. And if you feel like you want to be part of this set of organizations that are creating a shared expectation, around developing all youth through sports, and these are principles that make sense to you. There's no ask beyond that necessarily, other than you'll now be part of a community that we will communicate with as additional activation opportunities arise through the Bill of Rights in Sports project. We welcome you, and we'll celebrate the folks who have been added at the Project Place Summit on March 9th. So help us do this.
Thank you, Tom. Appreciate that. Thane, when you mentioned some of the groups that came together to kind of build the program there in South Dakota, but a lot of it, I think you mentioned also during the video, is that there's a lot of volunteers that get involved. What's the importance of volunteers in a program like that, and how do you get them to be involved? How do you get those volunteers to really kind of commit their time to help build the organization?
Sure. Yeah, I think it's crucial for most youth sport organizations. They are led by parents, and Tom mentioned that parents care about their kids. They want to do what's best for their kids. They want to do right by their kids, and that's a strength that you can leverage if you're organizing a youth sport program, is to really tap into that passion and that genuine love that parents have for their kids, to say, hey, we can't do this alone. You need to be the best advocate for a youth athlete is the parent. The parent can step forward and be involved. That's really key. In the case of South Dakota junior football, what's really been to their advantage is they have had a number of parents who started off coaching in the league and matured from that to taking on board positions and continue to be involved in the league years after their kids have left the program. And to me, if I can point to one thing as to why that program is so successful and why they've been able to sustain what they have over the years, is that they have this core group of board members that believe deeply in the sport of football being a vehicle to help athletes develop as people, and using football as a means to teach not only about how to become a more physical athlete, but how to become a better leader and a team player, and all those life lessons that they believe strongly in putting that program together. And so it's that continuity. And I would just encourage those from around the country, when you're building your program, is to find those passionate people, and they don't have to be in a particular position of power or influence, but because it's that passion that's really going to play out. And you're going to find that in parents. You're going to find that in parents that are going to want to, again, do whatever they can to help their kids. And you start small and you start building upon that. You say, what can we do to get better this year? What's one small step we can do to get better? How can we grow a little bit incrementally? And again, over time, you can not only create a better program for your kids, but you can create something in your community that will benefit many others. It's not easy. That's one of the things. It's not easy. I mentioned it in the video. It takes effort. It takes one or two people probably getting frustrated because people aren't returning their calls or their emails and don't want to participate this year. So you have to find other people, because you can't do it all on yourself. It's too much weight to put on one individual's shoulders. So there is effort involved. But if you can find the right team, like in so many things in life, you find the right team, you can do a lot together.
Thank you, Thane. Appreciate that. Karen, you are the chair of the sports sector of the National Physical Activity Plan. There's, as you mentioned, there's several other sectors within that plan, and each sector has strategies and tactics and objectives that people can work on. Why is it so important to work on those strategies and those tactics? What if you're a community or organization, why is it so important to kind of work on those different strategies and tactics?
Yeah, thanks for that question, Monty. I think the whole point of the National Physical Activity Plan is really, as I mentioned, it got rolled out to support the national U.S. physical activity guidelines. And we know that from all the way from children, adolescents through older adults, we don't have our entire segment of the population meeting guidelines. In fact, at best, it's usually about half will be meeting guidelines for any particular population group. And sometimes people don't know where to get started. And certainly, as I mentioned, this plan is built on the social ecological framework. And so you can do things at the individual level, but we really have to be cognizant about the community and policy level types of things. And that's where organizations can come in and play a role and make an impact by providing those opportunities and making things happen that are greater than just what the individual can do themselves. Those are the sorts of things we need, because the more supports that we have for physical activity, the more likely people are to engage in the physical activity. And of course, we would like to see everyone meeting the guidelines. And if we can all try to follow this roadmap and act at all those different levels of the social ecological framework, then I think we have a real shot at improving this at the population level, which will be beneficial for health outcomes and for just general feelings of well-being for everyone.
Thank you, Karen. Appreciate that. Hey, Tom, you mentioned in your Bill of Rights, one of the tenets you have is to be treated with dignity. Can you expand on that just a little bit more and what that means for kids as they're trying to play youth sports?
Yeah, so it just basically means, having coaches respect you, to kind of really boil it down. We're moving and we're moving from a culture of coaching that was very command oriented. The coach is the boss, and here's what you need to do, and here's how kids are going to play, and this idea of tough love, and really sometimes even getting in kids' grills as a way to kind of develop them. We're moving to a place where some of that behavior is not necessarily appropriate, well-meaning but not necessarily appropriate. It lapses into the space of emotional abuse and sometimes even physical abuse. So children are human beings. They are born with a certain set of rights. And in a sport context, we've allowed certain behaviors in the past that maybe are not, that coaches are allowed to engage in, but we would never accept from teachers, for instance. So how do we create more consistency in how we deal with kids, and how do we empower coaches to be, to help kids in the way that they want them helped? It's maybe there are other techniques that they can use, stuff from the Positive Coaching Alliance or otherwise, the sandwich type of criticism, or the magic ratio type of stuff. There's a way to work with kids and treat them with dignity, but also challenge them in an appropriate way to be better, to get better, and to be part of a team environment that promotes competition.
Yeah, thank you. Appreciate just building out that just a little bit. Nathaniel, I think we have time for just one. You'll be our closing answer here. Recognize the time, but one of the other things that's in the Bill of Rights is having qualified program leaders and includes coaches, as Tom mentioned, getting the coaches tactics they can use to be better coaches. What are some of the things that the South Dakota Junior Football did, to make sure their leaders were qualified and that their coaches are trained appropriately?
Well, they worked very closely with USA Football, the national governing body for the sport, both in terms of the coaching education and certification resources, but also, as was mentioned in the video, the early adoption of the football program, subsequent programs through USA Football. So those are requirements for all the coaches in that league, and they've worked with other corporate sponsors to help offset some of those fees that are involved for the coaches, and that doesn't become a barrier for a good coach who wants to get involved, that may not be able to do a certification or whatever the case may be. But they've turned to USA Football, who provides tremendous resources for youth football organizations throughout the United States, and there are many other national governing bodies that do the same for their sport. So it's really key for the local youth sport organizations to tie into their national organizations, their national governing bodies, because there's just tremendous resources, and many of these are free resources as well that are available to those individuals. Tom touched on it. We need to give coaches the tools. Many of these people are volunteers and parents. We need to give them the tools to succeed. we expect them, and we always talk about qualified coaches are teaching our most vulnerable and most important athletes, the youth. It's flip-flop, that those that have the most education are teaching that at the highest level. So we need to work together to provide those tools and resources to parents and volunteers who are coaching our youth and give them that positive experience and the best developmental experience possible.
Thank you, Thane. And thank you to all of our panelists today, Karen and Thane and Tom. Thank you for being a part of this webinar. We really appreciate the great information that's been provided. This will be available on our website. I think it will also be available on the National Youth Sports Health and Safety Institute website as well. So this recording. And one final thing, if you want to get involved with the Physical Activity Alliance, please reach out to us and we'll be able to get you hooked into the different things that we have going on. We have a lot of different activities moving forward that help promote physical activity and health and safe sports for our youth as well. But thank you all for joining the webinar today, and we'll be back in touch soon. Thank you.